Oh, yeah. Yeah, so he planted and he got, but at least he's not a big name player, right? With no contract.
Right.
Right, but Dallas sucks.
They do.
Yeah.
Yeah. With or without.
Yeah,
that. I
yeah.
mean, they sucked with
So if
Dak
they suck, with an ankle fracture or without, does it really matter?
Yeah. Doesn't matter.
Doesn't matter. See, this is what they did now. Now it dislocates. But see, that's because I broke them too many times. See, they're making them different. They changed how they're making them because. Yeah, that's right. It was just kind of interesting how there's certain voices that you can just capture.
People say you sound like Ray Romano.
What? Who said that?
Somebody on YouTube.
Dallas Cowboys suck. And now they're going to suck even more. Why am I saying the Dallas Cowboys suck? Because they do. I'm trying to be edgy. Yeah. Yeah. See, this is what they call clickbait. Dak Prescott, you had a terrible injury. You watched the injury. He's moving to his left. He's trying to cut around a player, and he almost makes it and then gets tackled down, and you see what happens, okay? So, down here. So he lands with his leg, and he's going this way. So his momentum is carrying him this way. His cleats are on, so he's pivoted and, securely planted in the turf, okay? So this is stable. His momentum is taking him this way. And normally, if he were to get away, he would just keep his momentum going and lift his leg and go. But that's not what happened, right? He planted, and the other player's knee knocks him here. So basically, he's planted, cleats on the turf, his momentum's going this way, and he gets clipped, not by, intention. The player was just tackling him. His leg kind of clipped him here. So what happened is that he landed like this. He couldn't quite get his foot off, and then, nice sound, good sound effect. That was instantaneous.
Yeah, too.
And so what happened is he gets a fracture dislocation. So you saw what happened. He landed and he's like this, okay? Now, oftentimes with these fracture dislocations of the ankle, you can either completely dislocate, but more often than not, you have an associated fractures, typically medial malleolus, because it's on the medial inside of the ankle, lateral malleolus, because this is the fibula, distal fibula, which breaks more often than not, and occasionally, often, in a decent percentage of cases, you'll take posterior malleolus. In some cases, you'll actually involve most of the distal tibia, and in that case, you get a tibial plafond. According to what's out there, it was a compound ankle fracture. So what that means is that compound is a terrible word, by the way. Don't use it. Journalists, please stop using compound. If you grew up in the 1800s and early 1900s, compound was in fashion. There is no such thing as a compound ankle fracture. There's no such thing as a compound fracture. Please eliminate that from your entire dictum. Do you understand? Please. An open fracture is an open fracture, and that's what we call it. It's not a compound fracture. That's old verbiage. Get rid of it, please. Okay, sounds interesting. Maybe it's common enough in lay language that everyone understands what a compound fracture is, but it's not compound. Okay, so he had an open ankle fracture dislocation as far as the reports go. And so what was sticking out, we don't know. But what we do know is this was covered in his sock, and there was a big prominence here. Now that could have been the entire proximal tibia through the skin, more than likely. I actually just saw an ankle fracture the other day. That is exactly what happened. The medial malleolus stayed with the deltoid ligament, and the fracture was at this level, and the medial malleolus stayed down here, and then this part broke out, and transverse incision, bone sticking out here, fibula fracture, and it could be down here, Weber A, at this syndesmosis, Weber B, but below, and above, Weber C, or all the way up, which is considered a high ankle. All right, So where did it happen? We don't have the x-rays. We don't have all the details, but we do know it was an open ankle fracture dislocation. You saw it sticking out. So what does that mean? Well, just put it back together. See, it's that simple. Anyone can do it. Let's assume it was a bimalleolar fracture dislocation. Bimalleolar, that means two malleoli, okay? Medial and lateral. Let's just assume for the moment that it involved both malleoli, not the syndesmosis, which is this joint between the distal fibula and distal tibia, and that he had a dislocation and he had an open ankle. Okay, so what's the first priority? You want to line it up, wash it out, clean it up, reduce the ankle, make sure it's in line, and then you fix it, okay? So priorities are stabilization, reduction, irrigation, debridement of the open wound. That's the most important. Preserve the tissues, protect from infection, update his tetanus, give him antibiotics, clean it out, make sure there's no dirt or fragments in the joint, and then reduce it, line up the joint, and protect the cartilage in that order. Then you deal with the bone. Kind of like a house. You know, if the roof falls off, what are you going to do? You're not going to repair the roof and then pop it back on, you know, and then deal with it, right? You first got to make sure there's nothing inside. You got to make sure it's all clean. You don't want any dirt on it, right? Then once you have it, you line it up. And then you do the repairs, right? That's the way you got to look at it. Okay, so let's say he had an open ankle fracture dislocation bimalleolar. Pretty straightforward. His risk of arthritis is there, risk of infection is there. If it's cleaned and washed out pretty quickly, he should do well. Ankle fractures, medial mal, lateral mal, if they're relatively stable, put some screws here, put some plates, one plate there, and maybe a lag screw, and he's good to go. What's the recovery time? 6 to 8 weeks of healing, 3 months rehab, back in the game the following season. What about a syndesmosis? Now, syndesmosis is if you get separate, well, okay, see, these newer bones just are so soft. You know, which kind of brings up, do you remember the talk I gave a while back about all these high pro athletes breaking bones with minor injuries? And that was in basketball. You know, I'm seeing a lot of this. So what's happening? What kind of anabolics are being used? Now, I'm not saying they're steroids. Everyone gets screened now. I'm not saying that, you know, they're hypervitaminized or hypervitaminosis, whatever you want to call it. Are they getting a lot of vitamins, calcium, vitamin D, all sorts of stuff? Is there a drawback to that? What else are they taking? Are they taking creatinine? Are they taking other supplements? Maybe there's other things happening. I'm seeing a lot of fractures just happening really, you know, with trauma. But, you know, with these high-end athletes and their bodies, they got a lot of weight, they got a lot of force, they got a lot of momentum, and one can assume that, hey, they're going to break. But how often did that happen 20 years ago versus now? Are they faster? Are they better? Are they stronger? Are they have more momentum? Is the turf better? Is the shoe better? Is something else going on? So it kind of makes you think, right? Just think about that. That's all I'm going to say. Because I don't like anyone getting injured, especially the athletes, because we're all athletes, right? Like, I'm as good as Dak, right? I could play the game. I'm an athlete. We're all athletes, right? Right. Okay. So say he had a syndesmosis injury. That's the joint in this space. Tibia, fibula separates, and then you have to repair that area. You got to get it in line right at this junction, at this joint. Make sure it's congruent. That could affect a little bit of ankle stability if it's missed. I highly doubt it's going to be missed. They've got experienced surgeons to the Dallas Cowboys. Actually, hope you guys are all okay in Texas. It's all fun and games, but I heard about the news. You know, prayers and blessing out to you, Texas people, about what's happening there. Electricity, freezing, snow, rain. Hope all is well. But in any case, he's apparently recovering well and rehabbing. That's what we know. But is he going to be back in the game? We don't know. That raises a whole other set of questions. Now, I don't know about contracts. I don't know about franchise taxes. Oh, it's not taxes. Just making fun.
What it sounds like is that he's going to have more of a mental hurdle next year than a physical hurdle?
Oh, it'll be both. No, he'll have a mental and physical. Even if he actually, it'll be both because, the one thing, if he's planting back there, he really has to trust that ankle, okay? Trusting your ankle or any joint after an injury takes time, and that's something that we see that a lot. ACL is a common example. It's after 2 years back in the game that you really start feeling that confidence in your knee coming back. Even though a lot of athletes, they'll have their ACL, or even some that don't have an ACL and do well, they'll do reasonable, but they really excel after that 2-year mark after their ACL. And it really comes down to proprioception, balance, strength, kinematics, overall mental and physical recovery. Now, the one of the challenges is that this is his back leg. It's the leg he plants and throws and pivots on. So that's going to be one of the challenges that's going to happen. So I think the first year back, I think is going to be a challenge for him and any team if he stays at the Cowboys or otherwise, in my opinion. But, superstars are superstars. Even then, he's at risk for cartilage injury, pain, ankle, stiffness, and then the rehab process. Muscle atrophy is the thing that's going to be challenging. And these super athletes, and we know this from Tour de France riders, 2 weeks off the bike, and they're 6 months behind their entire athletic regimen. So it's really important that, they're going to lose a lot of muscle. They're going to lose time. They're going to use their mental game, their physical game, a lot of that aptitude, fitness that people talk about muscle memory. Sure, muscles don't have memory, but you have a loop feedback neuromuscular reflex from your cortex down to your muscles, into the nerve fibers, right down to every aspect of your joint and mechanics and kinematics of your joint. So you have this proprioceptive kinematic balance and memory of how you move. That will change because when you first start moving, things are going to be awkward and stiff. So even though you get the cartilage perfect, there's a jagged line where the fracture was that extends into the cartilage. So that's always going to be there even though it's perfect. That has to heal. Native hyaline cartilage doesn't heal with hyaline cartilage, and that means it's a different type of cartilage, fibrocartilage. So maybe he's going to get some, stem cells, PRP, all sorts of different injections, and some bone healing anabolics like Forteo or Tymlos thrown in there to help his bone healing, which are all going to be off-label use anyway. And off-label use means that certain drugs are used and indicated by the FDA to be used for certain diseases, diagnoses, and disorders. And if it's off-label, because I as a physician can do whatever I want within reason in terms of evidence-based medicine, could use something off-label because the FDA doesn't label it for that specific indication, and therefore it's off-label use. But hey, only I can do that as a doctor. Yeah, okay. So off-label, limited, but in any case, off-label use makes sense. Eventually the FDA should and will give on-labeling use for bone healing for certain drugs because we need it. We have to get on-label use for these drugs because people need to heal faster, better, stronger, okay? So, he will recover. Cowboys will be back in the game even though they will suck. Dak will not suck. The Cowboys will suck, and that's inevitable. Oh man, there's gonna be so many.